Hi, Dr. Gary Rademacher here from Downtowns Healthcare, and today I want to talk to you about the insanity that currently exists in this country and how we take care of joint problems. Now, if you've ever had a joint problem, typically, it's either going to come from a trauma or more often it's repetitive stress, like maybe you have a muscular imbalance or you had a small tweak here or there and it's been getting worse over time, and so it's starting to break down. But this is what we currently do. So you have joint pain. What typically happens, you start to have an ache and pain, and what we've been taught in society is that we take something for it, right? Maybe you grab that non-steroidal anti-inflammatory, right? Oops. Okay. Aleve, Advil, Tylenol. You take something over the counter to try to keep that pain calm down, right? You decrease the inflammation. Now, what happens typically if that doesn't work, what does one usually do? Probably takes more, right? So what you'll do is you'll actually increase that dosage, or you'll get something stronger, right? So as you actually increase that dosage, take something stronger, what are you actually doing? You're literally just decreasing the awareness. You're cutting off the pain, which the pain is telling you something's not right. And so what happens is you cut that pain pathway and you start using that joint more, and guess what's happening? If you guessed you're breaking it down even more, you're right. So let's just say that in this country, what we do is we start here, and then if it's not getting better, we go to the doctor's office, and they maybe, now you're getting a prescription, right? They do some type of prescription, okay? And basically, hopefully it's not an opioid, because basically, what do we know about opioids? They're very addicting. Unfortunately, there's over 75,000 people a year that are succumbing to opioids, and they're very, very addictive. And so, hopefully you're not going down that path, or you haven't. If you have and you have an addiction, just call 303-292-9992 and we can point you into a good direction of what you can do to get help there, okay? It's not your fault. It's just a very addictive drug. Now, if the prescription doesn't work, right, maybe what happens is that doctor takes an x-ray. You take an x-ray and basically they see some arthritis. If you have breakdown in the joint occurring, it tells us that you've had the problem for a while. So if you've had an x-ray and the doctor's telling you that you have arthritis or osteoarthritis, that just didn't happen overnight, okay? That tells me you've probably been doing this for a while and ignoring the problem. We're not fixing it, where you could have fixed the problem back here potentially, okay? Take an x-ray, they say you have arthritis, they're giving you prescriptions, they may send you to PT. But then what happens eventually, if the problem persists, maybe they do an MRI, right? And then maybe what happens is they do a cortisone shot. So you do cortisone. And just to let you know, cortisone, as good as it works to help decrease pain, it's not fixing the problem. Again, it's decreasing your awareness. In fact, there are studies that show that taking cortisone injections actually can cause other problems. And in fact, the joint can break down even more over time. Now what happens is if we continue to break down, what happens? Some of you may have actually gotten a scope. You have surgery, and they do some type of scope, and they take loose bodies out, or maybe you have some tears in the ligaments, and they fix those. But what happens as time goes on is eventually we lead to that replacement, which is happening at an earlier and earlier age in our society today. That doesn't have to be. If we would actually take a look and listen to our bodies and do something right here instead of taking medication, you could stop this. You could stop the insanity and stop this cycle that is happening to many, many people. Now, I'm not against medication, and I'm not against joint replacements when needed. But if we actually took care of the problem early on, you could stop this from happening. So if you're interested in finding out why you're having a joint problem, whether it's knee, shoulder, elbow, wrist, hip, call us at 303-292-9992, or click on the link below and basically find out if you can get help. Our purpose is to help people get better without drugs and without surgery. So I hope you found this very beneficial. Again, pick up that phone, 303-292-9992, and ask for an appointment, and we'll see if we can help you. You'll see multiple providers. Our goal is to find out what's causing this pain and knock it out. Now, if you're someone who has gone through this cycle and maybe you've had some cortisone injections and it's not helping, we help a lot of people at that stage of the game as well. Again, our goal is decrease the meds, okay? Avoid the surgeries. So again, Dr. Gary Rademacher from Downtown Healthcare, thank you for tuning in. Have a great day.